First pass metabolism. The tablet that must not be swallowed. A patient with angina suddenly develops severe chest pain. The doctor gives him a nitroglycerin tablet but tells him to place it under his tongue, not swallow it. Within minutes, his chest pain improves. Why would swallowing the same drug make it much less effective? The answer lies in first pass metabolism. What is first pass metabolism? It is the metabolism of a drug in the liver and intestinal wall before it reaches systemic circulation after oral administration. This process significantly reduces the bioavailability of orally administered drugs, meaning only a fraction of the dose actually reaches the bloodstream. How it works? First, during ingestion, the pill is swallowed into the GI tract. Next comes absorption, where the drug crosses the intestinal wall and enters the blood. Importantly, this blood does not directly reach the systemic circulation. Instead, it travels through the portal system via the portal vein to the liver. Here, metabolism occurs where enzymes such as CYP450 enzymes break down the drug. The surviving fraction enters bloodstream. The portal system acts as a critical bottleneck, where first pass metabolism reduces the amount of drug reaching systemic circulation, resulting in lower oral bioavailability. Routes that bypass the first pass metabolism. With the sublingual or buccal route, drugs such as nitroglycerin are absorbed into the systemic circulation without first passing through the liver, producing a rapid effect. Similarly, transdermal patches such as nicotine and fentanyl deliver the drug through the skin directly into systemic circulation. Injection routes, intravenous, intramuscular, and subcutaneous, also bypass first pass metabolism because the drug does not enter through the GI tract. The rectal route is different. It provides only partial first pass avoidance because only about 50% of rectal blood bypasses the portal vein. Drugs with high first pass metabolism. Some drugs undergo such high first pass metabolism that a large proportion is metabolized before reaching the systemic circulation. This reduces their oral bioavailability and may make oral administration less efficient. These drugs typically require alternative routes or significantly higher oral doses to achieve therapeutic effect. Important examples include propranolol, nitroglycerin, morphine, and lidocaine. Clinical importance. Dose adjustment. Drugs with high first pass metabolism require higher oral doses. Route selection. Such drugs are often given by sublingual, transdermal, or IV routes to bypass the liver. Liver disease variability. Liver disease can reduce first pass metabolism, increasing drug levels and toxicity risk. Sublingual versus oral. Nitroglycerin. Nitroglycerin is a classic example demonstrating the importance of first pass metabolism. When given sublingually, nitroglycerin is absorbed under the tongue and enters systemic circulation while bypassing the liver. This provides high bioavailability and rapid onset, which is ideal for acute angina. In contrast, when nitroglycerin is swallowed orally, it is absorbed from the GI tract and travels through the portal vein to the liver, where it undergoes extensive first pass metabolism. Consequently, very little unchanged drug reaches systemic circulation. Thus, nitroglycerin clearly demonstrates how the route of administration can dramatically affect bioavailability and onset of action. Key takeaways. To summarize first pass metabolism, remember 3 key points. First, Think of first pass metabolism as a liver barrier. After oral administration, absorbed drugs travel through the portal vein to the liver before reaching systemic circulation. Second, bypass routes matter. Routes such as sublingual, transdermal, and IV avoid hepatic first pass metabolism, while the rectal route provides partial avoidance. Third, liver disease changes everything. Reduced hepatic metabolism may increase the systemic availability of some drugs, so dose adjustment may be necessary. Common Viva questions. Before we finish, try answering these two commonly asked Viva questions on first pass metabolism. 1. Why is nitroglycerin given sublingually rather than swallowed for acute angina? 2. Name two drugs that undergo high first pass metabolism.